See, as far as this everything because of this pollution, what we are finding is that the medicine OPD is flooded with patients who are coming with respiratory disease, especially bronchitis, acute attacks of asthma. Then patients are coming to ENT OPD with attacks of sinusitis, running nose, and some people are coming with bleeding from nose. Then the dermatology OPD is also showing that some patients with dermatitis have increased. Similarly, ophthalmology, the eye OPD, they are seeing more patients which are coming with dryness, watering of eyes, redness of eyes, diminution of vision. So, and of course, the respiratory clinic, respiratory OPD is again having almost 20 to 25% extra number of patients related to all these pollution-related diseases. Won't say absolutely these are the only patients who are coming in ICU, because pollution-related diseases are not a separate disease. These are the previous disease where there is an exacerbation where the severity has increased. So like a patient who is having bronchial asthma, bronchitis, and old smoker, old patients who had tuberculosis. So because of pollution, they have increased chances of having a severe disease. The disease increases in severity. Many of these patients are coming to OPD. Yes, the number of patients which are being admitted in medicine wards has also increased. We are seeing a bit higher number of patients. As far as the ICU is concerned, yes, because of pollution also some patients may have increased, but I do not have the exact figure for that. See, the policy matters always relates to the state. I won't comment upon that, but yes, as far as the general population is concerned, I would like to request all the people who are more than 70, 75 years of age, pregnant ladies, people who have kids less than 5 years of age, people who have uncontrolled diabetes, cancer chemotherapy going on, HIV, and multiple other diseases where there is an increased chances of risk, they should avoid getting out until and unless it is absolutely necessary, number one. Number two, coming to those people who are in habit of jogging in the morning, yes, jogging is very good. Try to do it at home by a treadmill machine, or if you are bent upon for doing jogging outside, please do it in afternoon, not in the early morning, because of the low temperature. The pollution settles down, what we call as smoke. Smoke plus fog is smog. So this is the peak time where smoke cover is quite high. So try not to jog, because jogging increases the inhalation of pollutants also. Or if you want to, do it in afternoon. And those people who are traveling on two-wheelers, rickshaw pullers, you should use a mask, whether it is a blue triple layer mask or an N95, you should use it. When you come back home, wash your face, wash your eyes, wash your hands, frequent hand washing, and all of those people who are moving out, try to wear a mask, try to avoid over crowded spaces. That's the only thing we can do as far as the prevention is concerned. And all those people who have breathing difficulty, cough, sputum production, even blocked nose, running nose, please consult your physician and doctor first before doing any self-treatment.
Sir, any preventive measures for school-going kids?
Maybe that in a short span of time, if this will be the level of pollution, maybe the government will take some decision, but I'm not the right person to comment upon this thing.
This is the most hazardous air quality which we can experience, especially this year when it has come suddenly with the onset of this winter. And there is a whole lot new patients with throat irritation, rhinitis, running nose, itchy eyes, bad congested chest pain. So it has been a very bad weather to start with, and we are getting a lot of patients with the exacerbation of symptoms of asthma, COPD, and the patient who are suffering from ILD or any chronic lung disease or heart disease for that matter. So the pollution levels are really very high, and as you can see, almost everybody is having the impact of the pollution. Children and the elderlies, they are the most vulnerable group, along with the patients who have chronic conditions. So in my recommendation, it is better that when you're going outside, do not do any outside sports. Do not get engaged in jogging or any physical activity which is laborious. And for the elderly, I will request them to be inside home during the early mornings, avoid their morning walks. They can go for a walk after there is a sunrise, some clearing of the air, and that too with a mask, I will recommend. Obviously so much pollution, it is decreasing your life expectancy. Every year people who are in Delhi, they are getting exposed to this bad air which is none of their fault, and the life expectancy is decreasing. So if you can afford the luxury of staying away from your home, then obviously you should inhale the best quality of air, drink best quality water, and be away from the illnesses.
And for children, sir, do you think hybrid is the option?
Hybrid is, yes, definitely. The government has to come with hybrid. Every year this happens, and the pollution is uncontrolled. The vehicular pollution and the particulate matter is on the high. So hybrid is one modality. So as the pollution levels increases, they will have to go on to the hybrid mode.